There is a motion at the desk.
Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, NISCA moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that House File Number 4 be given its second and third readings and be placed upon its final passage.
I recognize the member from Anoka, Leader Niska, to explain the motion.
Thank you, Madam Speaker and members. This is the Commerce Bill. It was the language that we're voting on was posted on the 29th of May, and this is part of the work that we need to take up and pass. And I hope that I urge members to support the motion.
Discussion to the motion. I recognize the member from Hennepin, Representative Long.
Thank you, Madam Speaker. I urge our side to support the motion as well.
There being no further discussion, all those in favor say aye. Those opposed, nay. The motion prevails. The clerk will give the bill its second reading.
Second reading, House File Number 4.
Second reading. The clerk will report the bill.
House File Number 4, an act relating to commerce, establishing a budget for the Department of Commerce.
I recognize the member from Ramsey, Representative Herr, to explain the bill.
Thank you, Madam Speaker. House File 4 is the Commerce Budget Bill. This bill, has changed just a little bit since the last time all of you heard this. This does fund the Office of Cannabis Management and the Department of Commerce. And in this bill, there are a number of provisions that were brought forward and have been heard by the Commerce Committee and on the floor. And what I will say that and just lift up is that this bill then includes a couple of new provisions, which includes exempting keys from Minnesota's lead prohibition for 3 years. It also exempts some paints from Minnesota's cadmium prohibition and establishes a consumer protection for retail EV charges, in addition to transition plans for analog phones for VIOPs, and then requiring Minnesotans have access to water at entertainment venues. These are some of the new provisions that were put into this bill. There was also some compromise language that when we were in the session, there were a couple of items that we were still working on. One of them was Medigap. The other was the 64J, which is the mandate process, and in addition to that, guaranteed renewability. And so with that, there was a lot of compromise, and Representative O'Driscoll did a fantastic job working with me and Senator Klein in order for us to get this bill to the shape that it is in now. And so that is what the bill is, Madam Speaker.
I recognize the member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. As Co-Chair Herr said, we had a very good bill coming off the House floor, both policy and finance, and it got better when we got to Conference Committee. I want to thank the Senate for their work in bringing forward some reforms on telecom. Without getting too much into the details, some of the legacy stuff from the early 1900s and laws that require telephone service have been now updated into the 21st century, which helps a lot of folks in a lot of different areas to have affordable telephone. We are also able to extend the reinsurance program for another 2 years for folks in the individual market. And as Co-Chair Herr said, we were able to accomplish a large number of things in the insurance realm. This is a solid bill. The provisions that we had same and similars with the Senate, we prevailed on a lot of those because our language was actually better thought out and vetted out. I think that's what happens when you have two teams working on this in earnest together. And I would recommend members to vote yes on the bill today and stand for questions if needed. Thank you, Madam Speaker.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 4.
Third reading. Discussion to the bill. I recognize the member from Olmsted, Representative Liebling.
Thank you, Madam Speaker. Would Representative O'Driscoll maybe yield to a question?
Representative O'Driscoll will yield to a question. Representative Liebling.
Thank you, Madam Speaker. Representative O'Driscoll, I am curious about the Medigap proposal, which, from my point of view, came out substantially worse than what the Senate had, certainly. And I'm just wondering, it's my understanding that what is in the bill is not being done in any other state. So what is in the bill with regard to Medigap treats people between the ages of 65 through 70 differently than people 71 and over, and has does have guaranteed issue for those first 5 years with penalties that increase rather steeply. And I'm just wondering where that all came from, because my understanding is that, well, I know that probably Blue Cross Blue Shield was in the room, and I know they sell a lot of these policies, and I think they had a lot of input into this. My understanding is that the consumer representatives like AARP and the Lymphoma and Leukemia Society had no input. And I'm wondering where this came from. What data is being used to decide what those penalties should be? What data is being used to set that age discrimination in the bill? And most importantly, where are there measures to track all of this so that we can see what actually happens as time goes on, whether those costs really do justify those steep penalties, and exactly what's happening. I hope that the Department of Commerce is going to track this, but I didn't see anything in the bill that requires any sort of reporting on it so that it can be revisited in the future. I hope that's not too many questions all at once, but I just think that given the importance of this issue to seniors in our state, who we are all supposed to be representing here, who were not at the table, I think they deserve a little more explanation and some answers on exactly why it's in there and how this is supposed to work. Thank you.
Representative O'Driscoll.
Thank you, Madam Speaker. And Representative Liebling, thank you for the question. As you know, the Senate didn't have a provision in their bill that dealt with a 2023 Medigap coverage that you had championed that basically said folks could switch from one Medigap policy to another at any time for any reason. And the House position when it came out had a full repeal of that. As you started digging into the issue, as you had mentioned, about finding out where we stand, we found out from the various insurance companies and through their actuarial review what we thought that the premium changes would need to be. Those are upwards of 90 to 100%, a doubling in premiums. And we thought from where you were at with 0 penalty, where the department was at with 15, and with what the industry and others were talking about at 90% suggested premium change, that we would have a smaller or lesser graduated in here stepping in on a penalty. And as Co-Chair Hurst said, that way we can also, by doing it over a number of years, get a chance to look at what's happening to premiums and make some decisions about how to move forward or how to proceed with either adjusting those penalties or repealing those penalties as is necessary and appropriate. I think I've answered all of your questions on that. So, Madam Speaker, thank you.
Representative Liebling.
Thank you, Madam Speaker. Well, Representative O'Driscoll, thanks for that. I don't think I really got a satisfactory answer. It sounds like, first of all, I didn't really hear whether you're going to be tracking the data. I mean, you did say that I think that you're going to revisit it, but it doesn't, didn't hear that there's any formal way that the data is going to be collected and analyzed and reported, so that's one thing. The other thing is, it sure sounded like you said that you really just listened to the insurance companies, which I guess doesn't surprise me a lot given how this turned out, but I don't know that I got a real answer about how these numbers were arrived at. Obviously, the insurance industry has a deep and abiding interest in being able to select their customers for these insurance policies. And just to remind everybody, most health insurance, you can't be denied any longer if you have pre-existing conditions. But in this arena, what we're doing is going back to the system where you can be denied for pre-existing conditions. Just to be clear with everybody, that's what we're talking about. But anyway, if you have anything more specific, I mean, I would certainly, even offline, if you have anything more specific about where these actual numbers came from, but I really would like to hear how this is going to have follow-up so that we can all be tracking it in the future and make sure that our seniors aren't being hung out to dry. Thank you.
Further discussion to the bill?
Oh, Madam Speaker, I'm sorry. I'm sorry. I want him to yield again, if he would.
Representative O'Driscoll will yield to a question.
Yeah.
Representative Liebling.
Thank you. Representative O'Driscoll, do you have anything further about, is this information going to be tracked in any formal way or reported, or exactly how are the seniors of the state supposed to know what's going on with this in the future? Thank you.
Representative O'Driscoll.
Well, thank you, Madam Speaker. Representative Liebling, thank you for the follow-up question. What we had done on not only this provision, but others that were in the bill in consultation with the Department of Commerce is we said we were going to be back and revisiting these issues. We learned an awful lot as co-chairs and with Senator Klein as the chair in the Senate about where the Minnesota insurance market actually stands right now. And so the insurance companies that you're referring to, they certainly have a vested interest in being able to be viable, that we have a stable and orderly market, and they want to continue to share information with us and be transparent. So I didn't think that it was necessary for us to put anything in a bill that would compel them to do that when they were voluntarily and willing to come to the table and have a conversation. As the department was also very interested in wanting to learn more information. And so we thought that since folks were bargaining in good faith at the table, there would be no need necessarily to pick up language to compel us to have reports and to have data brought back. Thank you, Madam Speaker.
Representative Liebling.
Thank you. Well, thank you for that answer, Representative O'Driscoll. So what I heard is that we're relying on the good faith of the insurers to follow up and give you the information. And the rest of it was kind of trust us, we're the chairs. And I don't think that's very satisfactory with something as big and important as this. And I think that seniors in this state ought to be able to understand why they're being charged an arm and a leg should they need to, an arm and a leg extra, I should say, a penalty, a steep penalty if they want to buy one of these plans without underwriting, and why they can't get it at all without underwriting if they are over 70. So I think that's really unfortunate. I think with something this big and something this important to consumers, I would hope that there would at least be some reporting on it so that people could see and see what adjustments are needed in the future, because I think there will be some. And I for one, do not take the insurance industry at its word, because as you say, at least I'm glad you recognize it, they do have a vested interest. And I think the consumers need to be heard on this, and I think in the future, these consumer groups are going to be working really hard to make sure that their members understand what this legislature is doing with their health insurance. Thank you.
Further discussion to the bill? I recognize a member from Stearns, Representative O'Driscoll.
Well, thank you, Madam Speaker. Members, again, the bill has come back much stronger than it left the chamber. I want to thank our Senate counterparts for the items that they added to the bill, and I strongly encourage a yes vote on House File 4 here in this special session. Thank you, Madam Speaker.
I recognize the author of the bill, Representative Herr.
Thank you, Speaker Demuth. So I do just want to address maybe a couple of questions that Chair Liebling brought up, and that is that it wasn't the insurance companies that we did just listen to. I want to be very clear that it was either a full repeal, or if the insurance companies had their way, we would have no compromise at all, and that after 65, there is no ability for somebody to open enroll. And so this really, truly was a compromise. And that there was discussion as to reporting, to track this, and that to Representative O'Driscoll's point is that we didn't feel it was necessary to put it in here, because if we listened to the insurance company, they were telling us premiums are going to increase 70 to 80 to 90%. Which meant that for them, they want to track and they want to be able to look to see if the current penalties that are put in place for each year is actually sufficient to cover the cost of being able to have open enrollment and ensure guaranteed renewability for those first 5 years. So I just want to clarify that there has been an agreement, a verbal one, that we've had discussion on ensuring that we review each year. Is the penalty too great or not enough? Because the truth is that based on the data that we were seeing, it's very likely that these numbers are too low. And so I do appreciate Representative O'Driscoll for compromising with me, because the numbers are as low as they are, because I asked for us to have more reasonable numbers to look at and then to track them afterwards. So I just want to say thank you, Representative Driscoll, for that. Again, reminding the body it was either a full repeal, which would make this market destabilized and we would have another reinsurance situation, or we would have these huge penalties if we swung the pendulum completely the other way to the insurance companies, which would be raising penalties to 70, 80%. And so I think that this is a fair compromise. We as a group and the insurance industry and the Department of Commerce have all committed that this would be reviewed and it would be looked at. And so I appreciate Representative O'Driscoll's work on this. It truly was something, and no, you're right, no other state has done this. No other state has done this, and we are the first, and we did take a lot of time to look at what would be the best thing we could do to stabilize this market so that we don't have another issue with reinsurance, but to also still give people fair ability to buy into a plan. And I want to thank Representative O'Driscoll, who brought up the point in our discussions that it would be important for the industry to do a better job of advertising what is available in Medigap versus Medicare Supplement. And so we all know that this is an issue. We care about our seniors. All of us care about our seniors, and we'll continue to look to make sure that this does work the way that it should. And I would encourage a green vote, but I also know that people need to vote their conscience. And so vote your conscience. Thank you, Madam Speaker.
There being no further discussion, the clerk will take the roll. The clerk will call the name of the member participating remotely.
Olson.
House File 4. Olson votes yes.
Olson votes aye.
I monitor them closely. I want you to know. The chair didn't even know it's good. Who's making the decision? Amanda. She bumped her bill. She pushed it. The environment came from the Senate. Who's Peter Fisher anyway? Oh, yes. Oh, yeah, let's ask. What's happening? It's the reason why we're voting on the environment? No. Amendment problems.
The clerk will close the roll. There being 112 ayes and 19 nays, the bill is passed and its title is agreed to.